Hello, these guys got me cracking up before the mics came on, and I'm going to just admit it so I don't do anything weird with the intro here, right?
Yeah.
Thanks for that, Neil. He did what I asked him not to do, and if you listen to the last episode, you'll understand what the deal is with that. Anyway, hello, and welcome to another edition of Through a Therapist's Eyes, where we welcome you to see through the eyes of a therapist. This is the podcast where you get direct personal insights directly from a therapist in your own home or in your personal time in your car. You can help the show by subscribing, hitting that subscribe button on any platform that you listen to us on. Apple Podcasts allows you to leave rankings. That is very helpful to what we do.
I've got to stop.
You got to stop.
Yeah, my eye is.
Oh, well, we're not going to edit that out.
Okay.
They can see you on the cameras.
That's fine.
It's okay.
I'm so sorry.
It's fine. See, we're in a cracky mood today,
Oh,
and it's fine. You know, there's
So sorry,
wrong.
friends.
Nothing wrong with that. Contact it Through a Therapist's Eyes for listener questions, thoughts, suggestions, and ideas. We respond to those 100% of the time directly by me, so it's a great way to get up with us. This is the human emotional experience, and we are going to try to figure this thing out together. So if you've been following the show, you know we've kind of switched up our formats and stuff, so we are doing guest co-hosts, and you have been with us, so welcome back, Miss Kasie.
Thank you. It's good to be here.
Right, so you're gonna be taking the month of September.
Yeah.
And interestingly enough, so we've got two therapist minds that you're going to be able to enjoy for a month, which is different than our normal podcast format. I like to have kind of somebody who's not a therapist. So actually, I kind of picked this topic tonight. What helps to make therapy successful and productive. So, this is going to be a really interesting show to you out there, honestly, guys, because for young therapists, I think you're going to really hear some insights from two pretty seasoned therapists. I mean, you've been doing this a long time. And also, if you're thinking about, doing therapy or seeking out your own experience, these are some things to really think about. And I get a lot of questions in my private life about okay, so how do you pick a therapist? How does this work? How do you access it? It's very confusing for people. And to that note, I looked it up. Episode 23, we did a show on how to access mental health therapy because, dude, it's confusing for people, Kasie, isn't it?
Yeah, it really is, especially when you have to not only navigate your immediate area, but figure out insurance, providers, referrals.
It's a lot.
It can get confusing real quick.
It's a lot. And so, but the genesis of this show, I'm going to introduce that, and then I want to help them understand who you are and stuff, Kasie. But the genesis of this show really kind of originated probably, I don't know, I was a new clinician, and I heard something that bothered me. I'm curious what you would think about this, Kasie. The average length at the time of a therapy experience was 3 sessions. Ooh. 3 sessions. That was it. And I see your facial expression,
world?
Right?
Yeah.
It bothered me, and it made me be very thoughtful for many years now about what makes it successful, what we do for a living. And I just kind of felt like, by God, dargum, we need to get better at that because that's not good enough. Something's wrong that people aren't getting what they needed to get. So that's kind of some of the genesis of this topic.
Yeah, right? I think that is completely chaotic.
What's inadequate?
It's inadequate. It's kind of chaotic to kind of put people in a vulnerable situation. They kind of come in, do their assessment, and then you're done in 3 sessions. That doesn't make sense.
Yeah, and I think a lot of that was people were just not getting what they wanted, not feeling it was helping them, not feeling, like this was something productive, and they would, jump out 1-2 times, maybe go 7 times, but that's also probably was averaged in. And I think that was a clinical studied reality. Now, interestingly, I was trying to get a fun fact when we get into that segment here in a little bit of how long it is now. And I have no idea. So I literally had a really cool experience show prepping for this, always for like 20 years, having the belief that that's what we're up against. And I don't think it's quite that way anymore, though. I didn't see anybody really kind of saying that's the standard average of sessions nowadays. Any idea? Have you thought about this? Do you know what it might be now?
No, I don't know what it would be for sure. But what I am encouraged about is that I think that it's more normalized now to attend therapy.
Right.
It's not as stigmatized as it once was. And even back when I was in graduate school, thinking through like standard practice, 12 sessions, 16 sessions, full package this, full package that, that's kind of gone by the wayside because I think, and we'll talk more about this as we continue, but meeting people where they are, kind of understanding what the need is, letting that goal drive the therapy session, you can't put a time limit on that.
Right. Yeah, and the standard therapy response when somebody asks the question, right? Well, how long is this going to take?
Yeah.
Well, it takes as long as it takes. I mean, I hate that canned response, but it is so true.
Yeah.
And there's no magic solution or answer to that question. As a matter of fact, I kind of feel like we're going to get to a place where, just like a family doctor, you have your regular person, that's your therapist person that you connect with, and we're already seeing that ingrained into family practice settings and things like that. So we're well along our way beyond where my career started out, where it was an average of 3 sessions.
Right.
So who are you anyway?
So I'm Kasie Morgan, a licensed clinical mental health counselor and qualified supervisor, which I think plays into today's session as well, because I do supervise younger clinicians and practice and things like that. So I'm really looking forward to us kind of delving into this topic today.
Yeah, and I'm appreciative of you coming in and hanging out with us, and just so that you know, audience, in the next month or so, you're going to kind of develop some topics, and you're kind of have some energy for doing this. I'll be here, but almost in a little bit of a different role. I think I'll take a little bit more of a following role, which will be fun for me. What do you got cooking for us, kind of? What are you thinking about that? You ready for that? I mean, I announced it, I guess, but you told me it was okay.
Yeah, no, I've got some things in the works, definitely some generational stuff. So looking at common misconceptions of generations. I myself am a millennial. So
You are not.
I am a millennial, 1980 to 1995, and I'm 83, baby, right here. I'm a millennial.
You've been doing therapy way too long to be a millennial.
Yeah, I'm kind of a cusper. We're going to talk about that, but we're going to talk about some common misconceptions.
You're going to have to convince me on that.
Yeah, we're going to talk about some common misconceptions and kind of how to, maybe reframe some things that maybe we've interpreted about different generational gaps. 74% of the workforce is mixed generational now, and so I think it's important to talk about.
Absolutely.
And then another topic that we're going to cover is toxic positivity.
Oh, boy.
The world of Pinterest quotes and how it's not always helpful. So we're going to delve into some cool stuff. Yeah.
Yeah, that's cool. That's good. Yeah, September should be fun.
Yeah.
Okay, let's go into a segment that I think is a cool way to start. What helps us to be productive in therapy? What makes this thing work? Let's do a little segment, just rapping back and forth. Can you help me describe, what is the result of a helpful and productive, successful, air quotes on the cameras?
Yeah.
I can use the cameras now.
Yeah. I'm like, I don't know where to look.
Yeah, what's the result that we're looking for? And I have definitely some passion about that. What would you say? I mean, what are we striving for in a therapy experience? What's the result? What are some results that you've seen?
Yeah, I think people finding their own truth and self-actualization. And really what I mean by that is that a person comes into the office, they have a situation, they have something going on, and they want to arrive at a different place than where they are now. And so we kind of talk through what are the barriers and what are the steps to get there, and then mitigating those barriers and working together on a self-actualized plan of how to arrive at the place they want to be.
Now, so you're using a big fancy word, self-actualization.
Yeah.
You know what that does in my head?
Yeah.
That's cool. What that does in my head, though, because I like to dumb things down, I always say in my initial assessment, one of the things that I'm really trying to do is I'm looking at how life is like now, how you want life to be like, in time. And I'm spending a lot of time, getting to that point. And that's really the idea, right?
Quintessential definition. Yep.
Right? It's really just, and I tell you, I wasn't going to talk about that, but I'm glad you brought that up because that's what my brain did with it. But, just to, this is why I created this whole platform with Through a Therapist's Eyes. I wish people can see, and I try to do it with words and videos like this, and to capture what it's like to experience this through a therapist's eyes, like through what we see, right? Like the dynamic changes that people have in their lives. To me, it is so humbling to watch somebody do that. I mean, they are literally changing their life right in front of our eyes, and sometimes rather quickly. It's amazing if you really stop. And I think us therapists miss the ground floor of what somebody's experiencing with that. Does that make sense?
Yeah, I think that makes a lot of sense. And it's what's so satisfying about the role of a therapist, I think, is when we have those aha moments with
Those are
clients,
awesome.
like when they get it and they link some things together and it all starts coming to fruition and that they just hit the ground running with kind of either a new perspective or a new view or able to kind of mitigate some of their emotions and life circumstances and really start to experience that growth element. And I think that is the biggest reward.
I think so. Absolutely. I'm curious. So aha moments, that's something that people think about that they're going to get. Would you say those aha moments happen rarely, sometimes, moderate, or often? Where would you say?
I think when people are fully participating in the process, they happen often.
In an active stage.
In an active stage of not just contemplating change, but putting forth effort towards growth and change.
Really engaging.
They happen often.
Okay.
I think
But that's a specific stage of really being actively working, which is kind of a little bit rare.
Yeah.
I think I find, and I won't use the word rare, but maybe isn't typical. That's the way I want to put that. People come in very tepidly sometimes and scared, frankly, intimidated, like, holy crap, what am I going to do? How's this going to work?
Right. Like, this is a stranger. I'm getting ready to tell you everything about myself.
Yeah. Like
Terrifying.
Yeah. Absolutely. And then maybe they can quickly get into an active stage. I think the point that I want to make here to you guys that are listening to the show is, there's an expectation that I'm going to get an aha moment and they're going to tell me what I need to do. And there's a process that you go through there. It's a dynamic relationship, a therapy relationship, unlike any that you have, I think, in otherwise. And you have to work into that. You'll get some neat and amazing moments where you connect things together that you've never connected. And I've got many examples of that. But that doesn't happen immediately.
No.
You have to be in an active stage, like really, I want this. And that you have to kind of build into. I think that's the point I want to make there.
Yeah, absolutely. And in my office, we often talk about 1% changes.
Yeah,
that
absolutely.
this is not you leave today and there's 100% change. It's a 1% change. What's something you can do differently tomorrow that will impact the future, but 1% at a time.
Perfect.
Yeah.
And 1%, 1 degree change.
Yeah.
If you're headed towards Istanbul and you make a 1 degree change in like Africa, you're going to end up in Japan.
Yeah.
Now, if you know anything about geography, that's way off.
Yeah. But like,
because the long-term changes of that are dramatic.
Yeah.
Really huge.
I really believe in that 212 mindset that I learned like long ago, where it's like water at 211 degrees is just hot water. But at 212 degrees, it becomes steam. And steam powers whole power grids, locomotives.
Metaphors.
It's that 1 degree of difference makes all the difference. It really can.
Absolutely. No, and again, it's just beautiful to watch. Mm-hmm. It's a beautiful thing to be a part of. It's such an honor that we have really with people. So here's a listener question that I want to spend a little bit of time on. And I talked about it a little bit with the 3-session, reality and how it's much longer now. How do I access and pick a therapist? How long does it take, right? Mm-hmm. We covered the how long does it take. How do I access and how do I pick a therapist? What do you say about that? Just curious off the cuff.
First and foremost, I want everybody that's listening in to know that you have consumer choice. That just because you go and see one therapist does not mean that that is the end all be all of therapists, that this is going to determine the experiences that you would have with every therapist. That's the first thing I would say. The second thing is if you're able and you have access, do your research. Usually a therapist will have a bio online, and it'll kind of describe for you a little bit kind of what they kind of do, what their orientation is in terms of how they counsel people, what they believe in, things like that in terms of the counseling experience. So read that and then kind of align yourself in that way just by doing some research.
And I'll tell you, I think it's going to come out at some point today, but when I'm picking a therapist, because I've worked with a few, I want to have a conversation with them. So that's one of the suggestions I put out to people is get them on the phone, have a conversation. Like, I want to know what what you're going to do, but be delicate, because it's tough to do.
Yeah.
It would be on the phone all the time, but it's definitely, if you're really questioning this one or that one and you're not really sure what that bio is, that's a reasonable thing to do.
Yeah.
Very reasonable can I have a conversation? Let me ask you couple quick questions, and really you can get everything you need in like 5 minutes. So you're not going to be on the phone for half an hour.
Right. And I don't buy the first car I test drive. You know what I mean?
Absolutely.
And so I think it's worth saying that if it doesn't feel like a good fit, then do not continue to re-expose yourself to that like inappropriately or ill-fitting kind of therapy situation. You have choices.
Absolutely. I love the way you went off there right off the get-go. There was a cool Psychology Today article that I thought was pretty cool about the fears of it taking too long or something going on. And they made some cool points. I thought it was interesting. What do you hear when this article talks about? Because I didn't read the article. I skimmed stuff and check my own ideas and what I've brainstormed. But they pointed out models of therapy: an illness-based model or a wellness-based model. Isn't that a cool differentiation?
Yes.
Right? And they said basically the therapy lasts as long as you decrease the symptom sets that you come in with. That's an illness-based model, which is fine. A lot of people tell me, I don't want to feel anxious. So how do we get to deal with some stuff? We've significantly decreased your anxiety. Okay, we're good. We're done. But the other side is a wellness-based, and that's where you have a lot more of the active phase of treatment that you were talking about, where a lot of the aha moments come in. You don't get a lot of aha moments, I would argue, with illness-based model.
No.
You're just alleviating symptoms. That's, depression. How do we get motivated? Bipolar. How do we manage that? Okay, we got it. And then you'll be kind of done. But a wellness-based is a little bit different, totally different direction. I want to be well. I want to improve my life. And that is a very different set of outcomes. Does that make sense?
Yeah, I think that makes a lot of sense. I think that, for a long time in that illness-based model, which, I mean, it has its place, like there are some people that I think do great in that model and function appropriately.
A lot of what I do.
And, and I think that's wonderful. And brief therapy, like those brief approaches are really kind of like speaking to some of that, right? But I think that what gets missed sometimes, or what we think about, is it focuses a lot about like what's wrong with me. And I think the wellness approach, which I love, as you're well aware of, is more about what's right with you and how to expand that into other facets of your life.
Feel empowered.
Yes.
Add some significant,
sophisticated
emotional sophistication added. Feel engaged in my life. Feel, the passion. Yeah. That's a lot of wellness.
Yeah.
Right. So let's misspell some things. This article still went into some couple other things I thought was cool. Some identifiable fears of being overly dependent. I'm moving too slow and the therapist is frustrated. I have been there for this long, 3 months or 3 years, and I'm not well yet. Will I ever get better? Maybe a better therapist would have cured me by now. These are some things that they pointed out. And I think there's a lot in the definition there, that what are your expectations, which maybe we'll talk about. That's a dangerous thing, because you can have gross misperceptions about, well, I'm going to be great. My marriage is going to be saved in 5 sessions. And it's like, okay, wait a minute. What are we trying to, again, my question when I initially start off, where is life like? Where do you want life to be like? And that's where, we're pushing to.
Mm-hmm.
I'm going to be bold for just a second.
Here we go.
Yeah.
When are you not bold?
Good point. This may ruffle some feathers, though, in our field, honestly, because I have a little bit of a pet peeve here for young therapists that are out there. This is really kind of more specifically for therapists. I will hear clients have said before, that the therapist brought up that, I think that we're done. I think we've accomplished what we need to accomplish. And therapists are afraid oftentimes that the client is going to get too dependent on me. And I don't want that. I don't want to foster dependency. I don't know where this comes from. This fear of clients being dependent. I really don't. And furthermore, I contend that when a therapist is suggesting that oftentimes they're very much feeling stuck themselves. Mm-hmm. And I don't want to ruffle. I mean, I'm afraid I'm going to upset some people by saying that, but I think that's the truth. And the truth is, we do feel stuck. And I'm gonna give you a little bit of a tip if you're working with me in therapy. Here's my tip to I feel stuck. I will ask a question in therapy. So if you hear this with me and you're in therapy with me, this is what it means. Okay? I'm stuck and I'm not sure what we're doing here, and I'm not really comfortable with that. So because I want to be productive when I'm working with people. It's important to me. And so I will say, okay, let's just reevaluate. Where are we at? What are we, what do we need to focus on the most right now? Right?
Yeah.
And some therapists in my readings, actually, there's some suggestions about that's what makes therapy productive. I'm actually using it more when I'm that pointed on it. I mean, I'm probably doing the same thing and evaluating our goals all the time, just every session almost. Mm-hmm. But when I'm that pointed with it, that means I'm stuck. I'm kind of like, okay, we need to increase numbers or decrease numbers. That's a strategy for young therapists, meaning you take people out of the room or add people into the room. It's just a therapy technique, to get some new things and figure some stuff out. So that's a tip for young therapists. But I don't know. Have you heard that before? Do you think I've pissed people off?
No, I don't think that you're making people angry at all with that, because I think it's the honest to goodness truth that unless there really is an egregious, boundaries related issue with a patient that I have, if something is an overstep, then we're going to talk about it. But outside of that, to me, the client drives the treatment protocols, and
right.
If I'm implementing my goals for the client, then this is a backwards relationship that we've developed already. So
it's a little ethical thing.
Yeah, it's an ethical thing. And so I think if you are stuck and you're unable to get to a place where you're asking really effective, open-ended questions about where we're at, then it's very appropriate to seek out supervision, even if you're done being a supervised associate licensed clinician.
I've come to you in the short time you've been here how many times?
Yeah, and we don't violate confidentiality,
Right.
but we're sitting there saying, let me bounce something off of you real quick. This is what I'm dealing with, and to get that supervision angle, that objective lens, because we've been at this for so many months and it's gone in a different direction, or it's gone in a different path than what we initially intended. And so
Right.
I think that's very important, but the client drives the treatment protocol.
That's a good way to put it. Mm-hmm. Yeah, thank you for that. All right, let's get to the good stuff.
All right.
Right?
Yeah.
What makes therapy successful? What makes therapy productive? What are some of the things we're looking at to arrive at what we described is where we want to kind of get to? I don't think I want to just catch cold or see. I mean, have you thought about that in your practice over the years? What do you think about that? What do you strive to kind of try to create? What do you try to do with people in the therapy relationship that you feel like? Because I know you're a pretty successful therapist. I've observed that. I've seen it.
Thank you.
Absolutely, and I mean that as a compliment. You really are a great therapist. I'm not going to try to make you blush, but you're awesome at what you do. What do you do to make yourself awesome in the therapy relationship, or to help that progress and get strong?
Yeah, I think the first thing is building just really authentic rapport with people.
Keyword authentic.
Authentic. Yeah. Mm-hmm. Because I don't know about you guys, but you can't crap a crapper over here, okay? So I am definitely someone.
Nice PG version there.
Thank you. I was going to say the other, and then I was like, no, we're live. But I'm definitely someone that believes in the power of a relationship in a professional setting. And so I think that relationship has to be authentic, because you have to trust me as the therapist, and I need to develop that rapport with you, that when you come into my office, you have an authentic experience, that we're not really beating around the bush. We're not getting off top, that we're really kind of focused on the objectives that you find to be important. And I need to arrive at that while we're talking in the course of the conversation.
Absolutely.
Yeah.
And I think something I want to add there that you just triggered in my brain is that authenticity, and another word is being genuine, is really important. I will use self-disclosure in sessions, but honestly, it needs to be, and this is very important, everyone listening out there, particularly younger therapists and whatnot, 100% of the time for the benefit of the person you're working with.
Absolutely.
It's an ethical thing there. You're not trying for your own venting session. You're not trying for your own, personal work. You're not pointing out your own insights and stuff. You're really disclosing things at 100% of the time. And I hope that I'm, 100% is pretty hard, to be honest. But whenever I'm disclosing, even like when I talk about the Steelers in session, I mean, everyone knows I'm a Steeler fan. I will use that for rapport. I will use that with connection. I will use that for humor. I will use that for demonstration of self-care. I will use that for multiple reasons. And it's just a simple, fun little opening in a session. But for me, everything's purposeful
right
in what you're doing for moving to where we want to be. Does that make? I think that's that's an important part.
I think that goes without saying, but I believe that is a downfall sometimes of therapeutic relationships between clients and
it's a
therapists.
Risk. Yeah.
It's a risk, because what that does is it opens up to a lot of other issues in that dynamic. It makes it more of like a friendly setting instead of a therapeutic setting, and it is perfectly normal for you to feel close to your therapist. I mean, you're having, in-depth emotional discussions with a person that knows a lot about you. So it's perfectly,
maybe more than anyone else.
Maybe more than anybody else in your
Literally.
life. Like that is a close connection, but that connection does not come without boundaries. And so that boundary is that, you might know certain things about me, but this is not about me sharing my life with you. It's more about you.
Point is your life.
Yeah, and developing insight. And that's really what this is just kind of a reflection piece to be able to bounce off like what's going on, where we're at in that process, what the barriers are, and how do you get to where you want to be.
However, on the other side of the coin, I do find that people are afraid of self-disclosure and genuine authenticity in the relationship, and that's important, because I can't tell you how many times I've talked to people and are like, look, if you don't get me, if you don't really understand me, and you can't relate to me, then I'm not working with you. I'm out, and that's where you get to 2-3 sessions and you're out. And so that's a helpful, very important part of a successful therapeutic relationship.
Yeah.
I would say.
I agree, but I also think that you can smell a faker from like a mile away, right? So even in those quips and stories and relational kinds of things, being your authentic self is really important. So to the younger therapists that may be listening, or even veteran therapists, because I see it all the time, different places
Good
too.
point.
It's not just younger clinicians. I would say, if you're going to impart knowledge about something, you better be sure you actually have knowledge about it.
That's true.
Yeah. Like Steelers football.
That's right. Don't tell me about the lineman if you don't understand who Alan Faneca is, okay? That's,
right. Yeah.
He's a left guard that just retired for the Steelers. Anyway, here's my answer that comes on the top of my list. I think A and A2. We've talked about A2. The second thing, that's the way I wrote it on my show notes, because I was listening and show prepping and thinking. And I got to the second one. I'm like, wait a minute, that's almost equally as important. So we've talked about the professional relationship developed with the therapist and client. That's huge. I feel like that relationship development is almost the single most important marker of how successful and productive this is going to be. You've got to be able to relate. You can't relate, you're dead in the water.
Right.
You're dead in the water. So that was A2. But I've thought a lot about, and maybe it's just a different stage of my career. I might not have thought about this like the first half or first quarter of working with people. But I've developed a little bit of a belief of an insight model, like you can call it. I think it's important for people to develop. They come to us as professionals for information.
Mm-hmm.
And in the beginning of the process, call it that, what do we call it before, the illness model. They want to know what's going on with them. And I've gotten really good at being able to kind of see some of the patterns, identify. We did a show, diagnosis is important. I know we're afraid of labelings and all that kind of stuff. If somebody has depression, I want to be able to describe to them their symptomology sets, what's going on, so that they know I'm not crazy. Like, I'm really experiencing something. And if you're able to tell me what I'm experiencing, I'll ask for symptom lists, and people will tell me, oh, I have this, and I have this, and I have this. And I'll go, well, what about this and that and the other? And they're like, oh, yeah, that, and that too. Instantly, like, they're learning that this is really anxiety and what anxiety is. So when I'm initially meeting with somebody, I know that I'm giving them way more information than they'll retain, more times than not. I'm doing that on purpose because I want them to leave thinking, wow, I figured some things out there. There's some information. So that information delivery, almost a teaching model. It's a teaching model in the beginning stages of the relationship. I want that, and I think that was at the top of my list. Sound crazy?
No, I don't think it sounds crazy. I think that it's really good to kind of even provide some differentiation there, because I think people get on Dr. Google and try to do some of that self-diagnostics. And I think it's important that when you come to see a competent clinician and professional, that you're able to knowledgeably speak to what's going on in a person's life, taking that information in and helping them talk through kind of what's going on, and being being insightful. Yeah. I see it a lot where people have gone to the doctor and they've had like a 15-minute appointment and they've come away with like a bipolar diagnosis. But then when we talk in therapy, they didn't disclose a trauma history to the doctor. And so now we're shifting that focus. It may not be bipolar. It might be post-traumatic stress disorder.
Right.
And how it manifests in their life is important. And so we talk through that and they're like, oh, that makes a lot of sense. And I'm like, yeah. And that's...
Or substance use disorders are oftentimes get missed, absolutely missed. And so you've got to have a well breadth of knowledge about, I mean, that's a big, thick book up there on our bookshelf.
Yeah, and there's been like 75 versions of it. So
right,
well, 5, but still,
maybe you're exaggerating a little.
I do exaggerate sometimes.
75
embellish
versions of the
a little bit.
Diagnostic.
Yeah.
That sounds terrifying.
Yeah,
know and read all of those. Because it's a big book, boys and girls. So I had the chance of kind of brainstorming this. You didn't, so I'll maybe go down through this stuff a little bit. You've got to have a safe space, right? Maybe I'll take 2 of these at a time. You've got to have a safe space, a comfortable place to be able to talk. I mean, we're in my office. This is a unique environment that you cannot replicate outside of a therapy relationship. I like to help people understand this, particularly younger therapists and whatnot. And sometimes, as you say, a good reminder for seasoned therapists, like, think about this. You and I are having a conversation a little bit. It's even a little bit prepared on my part, but I might be waiting for you to be done saying what you're saying because you triggered a thought and I want to go to that. I'm listening to you, but I'm ready to give my thought, right? And that's the way we converse, right? It really isn't even an exchanging of ideas. It's a comparison of ideas. It's a comparison of thoughts. And I'll be respectful. We'll have good pacing. But really, I probably half-time lose half of what you say because I'm ready to say something. Just waiting for the moment. Right?
Right.
That is not the way a therapy conversation goes. It's not. I am lasered in on everything you. And this becomes an environment that, de-escalates the tension, but then it's guided by where you're going. There's not a whole lot of agenda on my part. You can't replicate that with anybody else. Anybody else. Is that a fair statement? Doctors, do they have an agenda?
Yes.
Lawyers do. Lawyers have an agenda.
Spouses do.
Spouses definitely do. I paused in thinking doctor because they're similar to us in that their point and purpose is to progress your health. So we may brainstorm that, and that may not be an absolute. But if it's not for a couple of professions, you can't replicate it in your personal life. That's for way sure. Mm-hmm. Right? And
Agreed.
that safe space and that different focus. This may be the first time in their life somebody has ever experienced that for more than 5 minutes. Even when your close friend is really focused on you with your energy and your problem, and they're really there for you, past 10 minutes, I mean, for a full hour, that's a lot of time, which also is very intimidating for people to think that way. But it's not intimidating. And after you get comfortable, you get rapport, you do all those things first, and then you have that. I think that's a huge part of what makes therapy successful.
It really is. And some of my favorite experiences that I remember back on are kind of the naysayers of therapy that come in for the very first time. And they're like, I'm here because, my wife said I needed to come,
Love it.
or my friend told me I should probably try therapy.
Can
I've
you
never
give me
really
that
done
substance
it.
abuse assessment? They say I got a problem.
Yeah.
There ain't nothing going on here, so what you got?
Right. Yeah. And then they leave and schedule like 4 follow-ups, and now we're like in the thick of it, and they're like, wow, it felt good. I'm like,
Absolutely.
yeah, it's nice to have the undivided attention of a person
Powerful.
that is listening intently to what it is that you have to say.
Right. It's powerful. It's a big deal.
There's no competing priorities in this office, and that is very unique.
What about humor?
I love humor.
Right?
Yeah.
Do you use humor in therapy?
Yes. Have you ever walked by my office and heard me cackling? Of course I do. It's pretty loud, according to our office mates.
We have sound protectors up for Kasie and I. What did you tell me at one point? Like, Chris, you're abnormally loud.
Yeah, I'm like, I'm pretty loud, but you're abnormally loud.
I didn't say this out loud, but I'm like, what is she trying to say?
You're like pot, meat, kettle.
I mean, black is black, right? Yeah, no, I think that, it's funny. People are fearful about doing something that in therapy experience and in the relationship that is very normal when you're relating. Do you know what people do in their life when they've been traumatized? What is the phrase? You're either going to cry or you're going to laugh. So you might as well just laugh about it.
Yeah, like I laugh so I don't cry. I hear that every day.
It's a total coping mechanism. That is an important part of a therapy relationship. I like to tell people, look, we're going to have fun at times.
Yeah.
We're also going to needle down and get really serious. Like I might have to, if you're willing to allow me, to point some things out, I'll be honored to do that when people are learning early on in a therapy relationship. But we're going to laugh. We're going to have fun. And we're going to de-escalate the tension. Now, I will tell you, I have added on this part, specifically because I got a Google review one time, Kasie. This killed me. It really did. I was like, oh, no. So I have a common spiel that I will use, to help. I'll tell the person on the initial appointment, says, let me tell you a little bit about myself, how I work, what to expect with this whole process. And I go through a very canned, scripted. I even use the 2 same jokes. Now I've gotten to the point, I tell them I'm going to give you 2 jokes, and I use them. But I never used to say this part, and I've added this part to my introduction because somebody gave a Google review. And I think it was a legit review. We get a lot of weird stuff out there.
Spammers.
Right. But they said something like, well, it started out well. He was very easy to talk to. It was very productive. It was good. And then he laughed at me. Now, and I just went to get a different therapist. That's fine. I've been fired before. That didn't bother me. But anybody who knows me knows that I am very, I care. I care to a fault about a lot of things, and that killed me. So I always point out now, actually, in the initial session, I'm like, look, I do use humor. I hope that never comes off disrespectful because, what I'm doing, and blah, 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 and I go on. But I always point that out because there are some risks, with that. There are some risks, but I think it's good to have a part of the relationship.
Yeah, and I think that to point out here that there's a difference between having humor and having sarcasm in a session. Mm-hmm. Sarcasm is really left up to interpretation, and so it doesn't go over well.
Well, sarcasm is a form of anger.
Yeah, it really is. And I use it with my friends sometimes. But ergo, again, this is a professional relationship. Right. So
Glad you said that.
Yeah, humor is
sarcastic humor is not helpful a lot of times.
Right. And in fact, as clinicians, we often kind of warn against that sarcasm when we're in relationships with people and like in a work setting and things like that. So I think that there is a difference between sarcasm and humor.
Yeah. Really glad you pointed that out.
Sure.
Thank you for that, because that is a big component. And I think people are probably afraid of that, being interpreted that way. So next on my brainstorm, as I just check in, anything popping in your mind? I mean, you haven't brainstormed it as much.
Yeah, in terms of like what's important about therapy and
what makes it successful.
Yeah.
We're at the meat of this episode.
Yeah. So I definitely think that outside of like those first forming components of the relationship, I think consistency.
Okay. What do you mean by that?
I think consistency on the part of the clinician and on the part of the client. So like making a commitment to coming to session, unless there's a looming reason as to why you can't come to session. Okay. And for the clinician to make a commitment to your case, to be familiar with it, to be available, to show up. For a lot of the people that I've worked with, and this may be true for anybody that's listening today, sometimes in our history, inconsistencies have been part of what's really kind of, plagued our lives and has made it, difficult for us to move forward in a lot of different situations. And so I want you to know that when you come to my office, I'm there. I'm going to show up for you unless it's like illness related. I'm going to be there.
Sessions.
Yeah, we're going to be there. And so,
of course, COVID environment, you're a little bit more cautious now.
But there are other options. Like if you need to be at home, I can offer you virtual now. If you need, so on and so forth. But I think consistency is key. And what that also means for me as a therapist is that when you come back for your follow-up session, I'm familiarizing myself with what we talked about in our assessment. Yeah, I'm thinking through what we talked about last time so that when you come in there, it's not re-meeting me again. It's like we're going to jump in and be attuned with one another.
Somebody was literally telling me, like, the point of my whole therapy experience was this person in my life, and the therapist couldn't even remember, like well into the therapy. Right. Please don't hold us accountable for like forgetting a name or something. It's tough.
Right.
But well into the therapy relationship, they're like, they just didn't get it.
Right.
And it just conveyed, like, look, you're not caring. You're not doing exactly what you just perfectly described.
Yeah.
And it's important.
Yeah.
It's important. Of course, I suck with names. I try hard, but you have to be tuned in. So I love that. Consistency is absolutely an important part. Didn't have it on my list. Anything else coming on?
Yeah. And so for me, one of the key
she's just going to kill the rest of my list. Watch this.
Sorry.
She's going to blow right through it. It's awesome.
No, but one of the key components for me is build, not blame. And that is a core component, I think, of the therapy space, is that we are there, even in couple sessions and otherwise, we are there to build and not blame. And I think that's an important distinction to start making. And so I call it out. Like, sounds like we're doing a lot of blaming. Let's talk through
of others.
Yeah,
instead
let's
of
talk
self.
through of being self-reflective. So that reflection and building and not blaming, I think, is a cornerstone or a pillar of practice.
So what I hear you saying is building self up, sort of repairing internal focus as opposed to an externalized focus.
Right.
There's a fancy way of putting it: internal locus of control focus versus external locus of control.
Yes.
Yeah. That's a good thing too.
Yeah.
Absolutely. So feeling heard and listened to, active listening. It's funny. It was in my list. It was still on my list. I didn't think I want to highlight that as much, but I think what I'm thinking about is going back to like what I was saying about the type of relationship you develop in therapy. It's different than no other. And that's kind of a lot more active listening. But I'm pulling back from that a little bit because that was probably in my brainstorm a little bit earlier in my career years ago. That was really like a key component. And now it's kind of like, I'm more active now. I've even gotten more active in therapy relationship because of what you just said.
Yeah.
I want to join with you. I want to align with you and begin to build what it is that you've already got that's absolutely perfect and beautiful and you in place. Let's add to it. Let's build it. Let's grow it and stop being disempowered with what you can't control, which is other people, other situations.
Absolutely.
Your surroundings. You're totally disempowered there. So, but active listening is a part of it.
Yeah. Something I've really been reflective on as of late is a skill that, like when you're in grad school and you're having to film different skills that you do.
Oh, God,
I don't know what your experience was
hated
like.
That.
But
I hated it. Of course, it's what I
absolute
do
awful.
now.
Right. But this is so much more like of
It's
an
intense.
authentic experience, I think. But
Yeah.
one of the skills that I like had to redo in those taping sessions was the skill of silence and using silence appropriately.
Shocking,
As
Kasie.
you can imagine,
I'm shocked.
like sitting on my hands because it's like, oh, I'm going to wait. And I'm like counting out to myself the seconds because silence. Yeah. Like I'm just sitting on my hands.
Can I
thinking
speak?
through it.
Okay.
Right. Like, okay. And so, blah, 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 blah,
Yeah.
But really, that active listening component has really helped that skill develop for me as a clinician to be able to
Absolutely.
listen and give space to
Stop.
the thought.
Can you sit?
Yeah.
You know, it's funny. We're both talkative, as the audience can tell.
Yeah.
Right? It's not shocking. Yeah, I had to really grow that as well. And still to this day, what's funny is if my wife ever listens to the show, she'll be like laughing her ass off and maybe spitting eyeballs at me like, you don't use silence. You know what I really do in sessions?
Mm-hmm.
I will sit there for, and here's the trick with that. You use silence right up to the point that you assess it's uncomfortable for them.
Right.
But that challenges you and me, who are more talkative, to like jump in. Conversely, people that are more comfortable with silence and don't speak as much just with their own personality, they have to kind of push to get in there. Because I've had therapists who are just, they're not saying anything. And I've had people tell me in therapy relationships with me, they're like, the therapist didn't do anything. I can't, oh my God, it just drives me nuts. This is a big point. I didn't have it on my list. How did I miss this? Being active in sessions, I think, is really indicative of successful outcomes. If you're just sitting back, don't get me wrong. I know, please, before you send me hate mail, I know there's different modalities of treatment. Freudian, there's still some psychodynamic therapists out there. They're using, the here and now Gestalt-based therapy models. There's reasons why you're sitting back. But I don't use those a lot because, honestly, I don't feel that people can really identify with them. And what they come away from that from, until you're in that active stage that you were talking about, people will come out of that thinking, there was nothing going on there. Nothing happened. And so I think you miss an opportunity. You have to know your audience a little bit.
Yeah,
is
absolutely.
where I go there. Right.
Yeah, and I think advice is easily accessible. That if you want advice on something, just Google what you want to know, and you're going to get ready-made advice from someone, a message board. Every Joe Schmo's got an opinion on what's going on in your life, right? So you can get that kind of advice. The therapy experience is more closely related to that ability to kind of be engaged in a warm and welcoming conversation, but that also allows you to have an individualized experience. And I think that if you're not engaged as a therapist, that kind of goes by the wayside. Because if you're just going to be a warm body, then they might as well just Google what they want to know and get advice from a message board. Yeah.
Message board therapy.
This is a good idea. Do this.
Yeah.
Okay, sounds good.
And people, and by the way, message boards are great. As a matter of fact, I want to create one through a Therapist Tribe. It's just in my head right now, but I'm looking at Neil too, right? Like, I think it would be awesome to have a message board and a platform that people can interact. So through a Therapist Tribe, stay tuned because that may be a thing that we offer.
Coming to an internet search near you.
But it's not therapy.
No.
It's not therapy services. What do I say in the beginning of the show all the time? This is not the delivery of therapy services, but incredibly, incredibly helpful. I'm aware of the time. Let me buzz through some of these things,
problem.
Right? Understanding the tale of two tapes. I've described that on the show, the biological component and then the social and emotional component. I think you may have heard of that before. If not, I'm sorry, but I'm going to move on. Striving for consistency in the new behavior. That's exactly what you're talking about, right?
Yep.
How many of these that I have left that she already covered, Neil? I don't know. I thought this was a cool thing that I identified. In AA, they have something called HOW. It's an acronym. Mm-hmm. How does it work? In AA, they tell you honesty, openness, and willingness, right? That's huge as far as outcomes go. I could talk a little bit longer about that, but I'm not going to have time, I don't think, right? So the willingness is an important part there, though. You have to be willing. You have to show up. You have to kind of engage. Be wary of and examine the expectations of therapy. That's right. I thought I had it in here somewhere. In the beginning, we were talking about that. Expectations are dangerous unless, and this is in marriage counseling, I spend a little bit of time on this there. You have to make agreements or have long-term norms to be safe with having the expectations that you have. Right? Marriage couples do this all the time. They have expectations, but there's no long-term norm. Meaning, if you have Sunday meals at the table every week, and you've done that for 3 years, and it's Saturday, you can reasonably expect, without ever having talked about it, that tomorrow we're going to have a Sunday meal at the table. And it's a norm.
That's fair.
Right?
Yeah.
But if it's all spotty, you can't never know that. Or if you've made agreements, you can reasonably hope and expect that you will follow through with the agreement that we made. So those are good, positive, solid expectations. But when you come into a therapy experience and you don't have that one of those two things set up, you certainly don't have norms because you're just starting. So you have to make kind of agreements. This is a contracting. What are you really wanting out of this relationship? It's on our screening forms for a reason.
Yeah.
You know? So expectations and managing that is a really important piece. Another thing, be yourself as a therapist. I mean, I think if you're not being, we mentioned genuine, didn't? Yeah, we did cover several
authenticity.
Authenticity. Empathetic validation. Let me pause there. I don't want to piss people off again in the field. But you know what? It's sometimes you have to be purposeful about being empathetic. And if you're not challenging yourself to really care about this individual person, you might be doing something wrong because you really need to care. If you don't care, or if you get tired, or you have your own whatevers, and you lose your empathy, you got to recharge that battery. That's an important part of successful outcomes, I feel like. Does that sound controversial?
No. And I think that goes to just even outside of the office as a clinician, that like, if you feel like you're being empathetic in the moment in the space, but then you get in your car and you're cursing out everybody that merges in front of you on the freeway, and you're like, oh, well, one thing doesn't have anything to do with the other.
It does.
Check yourself.
It does.
Because you are losing that component.
Right. It's a good point.
It's an element of burnout for sure.
That's a little bit of an example of a sort of a soft confront. I think that we just did.
Yeah.
Because that happens. Mm-hmm. I'm telling you, that can happen. We call it compassion fatigue in our field. People call it burnout and all the different names you get for it, but that's real when you're engaging. So, yeah, you gotta take care of yourself.
Yeah.
Definitely gotta take care of yourself. Wrapping this section up, hope. Big one. I almost might even need to have that as like A3.
Mm-hmm.
Part of what we need to provide sometimes. Look, you're suicidal, you're separated, you're feeling desperate and alone, you're feeling, here's a very painful one, Kasie, invisible to the world. It's a horrible state to be in. If I am not offering some semblance of hope by what I know about emotions and mental health and psychological changes that can happen for you, I am almost doing a disservice.
Yeah.
I think that's part of what we need to convey. And that changes the outcome. When somebody leaves the office and they feel like, holy crap, there is hope. I don't feel it. Something happened there. I buy it. Let me come back. Let me see what can happen. I'm gonna put some faith out, and I'm gonna take that hope. Listen, I will have hope for you if you have none. That's a personal, guarantee, or that's something I will offer. I won't, you know what I mean?
Yeah.
I won't guarantee it, but that's something I will tell you. I will hold and contain in this relationship if you're not able to have that right now. Don't know where we're going. Don't know what's going to happen. Can't predict the future. I have no idea. I'm not reading tea leaves, but I know that things can get better.
Yeah. Hope anchors the soul.
Mm.
It does. It anchors the soul.
That's a good phrase.
Yeah.
Let me quote you on that.
It's from the Bible, so please don't.
Oh,
don't quote me.
Nothing wrong with the Bible.
Yeah.
Know your goals and review them well. I think I actually mentioned that before. Okay. Barriers we probably talked about. I know we're very up on time, and I actually read this article at the end here, and I wasn't going to use it much, But then I thought, wait a minute, I need to budget time in for that because this Psychology Today article was kind of cool. And so I've got time to do that, and I'm glad I did that. But I did identify some barriers, and I think that we talked about some of them. So let me just look at them, right? Be careful to avoid treating the wrong issue. Oh, yeah, I mentioned that. Substance abuse is a big example where, you know, I have a pet peeve again in my field. Like I told you, I'm passionate about this, and I've thought about this a lot. I do not understand, Kasie, why we have a mental health board and a substance abuse board.
Yeah.
You've got to have some semblance. If you're not an expert in it, that's fine. But I implore you out there, like, I just had a client today that comes from an alcoholic dysfunctional family. If you don't understand about anything about addiction, you're going to miss a huge part of that person's life. That's just almost, to me, people are going to hate me this episode, Kasie. I'm probably getting so much hate mail, but it's okay because it's genuine. It's what I feel. I feel like you're missing and almost doing a disservice because you can't help a person with an entire part of their life. Like, that's huge. You've got to... There's such an avoidance. Mental health people won't do substance abuse. Substance abuse people won't do mental health. Now, that has gotten better.
Right.
It's gotten better. When I began in my career, there was a huge divide. And finally, they developed this phrase called dual diagnosis.
Yeah,
like,
co-occurring disorders.
Right. I mean, this is huge. Our field has gotten better, and I think we still have some strides to make, though.
Yeah, 100%. And that was largely in part, too, because there were separated funding streams, which I think is absolutely bogus. And so I think that that's what drove those models to remain separate for such a long time.
I even dropped my papers, Kasie. I got into that.
So mad.
Good old misdiagnosis. That's a barrier.
Mm-hmm.
Okay. New life circumstances always potentially draw people back into same situations. And we need to recognize that as a drawback to success. This is not a aha moment that's going to happen immediately, and you got it, and you go along in a different direction. You pull back, you retract, and then you grow again, and then you retract, and you grow again. And I see that happening all the time.
Oh, yeah.
So, in the initial assessment, address the why of therapy. I think I mentioned that. What are you really looking to have happen? This is where an effective referral can happen, although, too. We know if there's something that we're not knowledgeable about, and to give the public a little faith. I know people have said, I don't work with substance abuse. I have people that do, and they will refer, and that's great. If somebody feels ineffective with a topic, they will refer you. Like, that's a basic training practice that we have.
Yeah.
Is that fair?
Absolutely.
Right?
Yeah.
We refer for that reason.
Yes.
So, and that's been happening since I began.
Out of scope, we refer out.
Right.
Done.
Right. Also, sometimes cultural barriers can arise. So those are some of the barriers that I had. So, yeah, we got a little bit of time, and how do I want to do this? I don't want to just spit through it. I guess I may just spitball through it, but I'm not doing it justice with what this article did. Psychology Today is generally a good resource. Have you ever?
Oh, yeah.
Look, yeah, you read on there and check that stuff out.
Yeah.
Dude, they got good stuff.
I do trainings through them, too, and live web events. Like, they've got some really good information on there.
Psychology Today's got CEUs? Okay.
Yeah. Well, I don't know if they have CEUs, but they have, like, webinars and web events that they have different professionals that come on and talk.
Yeah,
I don't
you're
do
just
it for
learning
credits.
and checking things out. Yeah.
Yeah.
Okay. Yeah.
Nerding out. Just nerding out.
Nerding out.
Yeah.
That's cool. I love it. Well, this article was cool because they identified some things. I think we mentioned them as well. I'm going to hit the ones that I starred as I was just reading down through it.
Okay.
While you were finishing your session today, that's what I was doing, waiting on doing this show. And I thought, well, let me read this one a little bit more. And I'm like, wow, that's why I wanted to add it as a part of the show. And I starred 3 things. Let's see which ones I starred. Because they were looking at qualities in effective psychotherapists. That's interesting. And as I said, A2, right? Mm-hmm. The relationship that you develop with your therapist is really, really important. Well, this article kind of needled down in it. I think you might want to check it out, Kasie, because I was kind of impressed with it.
Yeah, it sounds interesting already.
It really was. So the 3 that I starred: ability to explain your symptoms and adapt to circumstances as they change. I actually mentioned that. That's the insight model.
Yeah.
That's the illness model, where you need to be able to explain what's going on with you. I can see that. You started us off. I added the symptom sets. Maybe not all of them applied, but you get it because I added to it. And I can't tell you how many times people come in and say, well, I think I'm anxious. And we'll go down. They'll name a few of the symptom sets, and I do that on purpose because I want to see what they know, and then I'll add the rest. And they'll be like, a lot of times, like, oh, yeah, I didn't know that was a part of my anxiety condition. And I'm like, oh, yeah, of course it is. It's all a part of what people experience with this. And they're like, oh, wow, talk about aha moment. A lot of times that happens in the first session. Maybe it does happen more regularly than what I thought.
Thank you.
Right?
Yes.
Number 6, communication with a confidence, your confidence as a therapist in the course of this therapy.
Can I say something about that real quick?
Yeah.
Okay. If there is an area that you do not feel confident and more so competent in, get yourself some education.
Train.
Like, go to a training, talk to a supervisor, whatever the case may be. There's so much out there. There are free CEUs, there are webinars, good therapy, Psychology Today.
I'll give you an example in real time what I want.
Yeah, please do.
Sleep.
Yeah.
Why can I not find a CEU on sleep? I don't think I see much out there.
CEUs for less. I'm not plugging them, but there is one on sleep.
Is there?
Yeah, I've added it to my cart.
There you go. I'll look it up.
Check it out.
Because that's something that, and there are some things that you might not know a lot about because we don't know a lot about. And I'd argue with you that they may not have a lot of knowledge about it.
Yeah.
We had a Dr. Stafford on our show. He was awesome in that. He did that practice his whole life.
Yeah, but as therapists and any type of practitioners, we take oaths, right, to do no harm, and I would say that you are doing harm if you are speaking outside of scope without the competency to back it up.
Gotta know what you're saying.
That is a pet peeve of mine.
There you go.
I'm off the soapbox now. Thank you.
Kasie, we're going to tick a lot of people off, maybe.
We are, but it's okay. But I
and
think
it's important.
But this is real life. This is your life, and if the therapist is not attuned with the fact that this is your life and you are trusting me to assist you in your life, then that's a problem.
That's why I say it is so humbling and an absolute honor to work with people. I mean, the thousands of people that I've had the honor and privilege to work with, to a man and a woman and a child. I just can't convey enough. I tried in the book that I wrote, in the opening to give a little bit of that because it's just a big deal. Okay, some other things that they mentioned. I'm just going to spitball these, right? Possession of, because we've identified a lot of these actually. I think
because we're great.
You are great. Possession of sophisticated interpersonal skills. Well, that's interesting. Your own as a therapist, they're saying these are qualities in effective psychotherapists. You have to have a possession of sophisticated interpersonal skills, ability to help the person feel that the therapist can be trusted. Mm-hmm. Can you, as a therapist, convey that you're trustworthy? It's an important ability. Willingness to establish an alliance. Mm-hmm. You have to, I thought that was a cool way of putting it, right? Isn't a therapist always willing to have an alliance? No, you have to really partake that out. Like, I'm willing to partner with you. If you're willing to partner with me, let's go. It's a dance. We'll dance.
Therapists are always able to have an alliance, but they're not always willing to have an alliance. And there's a distinction. That's
the truth. Commitment to develop effective treatment plan, attention to progress, and communicating this progress, and that's an interest of yours. Psychotherapists need to convey that they're interested in your progress. Boy, that's a powerful thing if you do it right. Somebody's really interested in my well-being? Wow. Hopefully that happens in here. Flexibility to adapt to the client characteristics that are also changing. It's an important skill. Cultural sensitivity. Mm-hmm. Okay. Possession of self-insight. Boy, that's calling us out, right? A good psychotherapist has to have good personal self-insight. That's what the article said.
A lot of good therapists have therapists.
Right?
Yeah.
I thought there was a segment that we were going to get into that. That's the truth.
So true.
But boy, that's a myth. And one that I carried for a large part of my early career. I ain't doing therapy. Partly because...
You literally wrote the book on it.
Right. But I thought back actually to that. I was in college, and that was my first therapy experience. It was a one-off thing, a one-time session, I think, but That was before I even became a
One of
therapist.
your 3.
One of, I don't know how many, but I felt better about that because I was like, wait a minute, oh, I did go do that, and so that's cool. But I can't tell you, therapists are afraid to be in therapy. We have a hang up, and that's not. Yeah, you have to. What'd you say?
Some of the best therapists have therapists.
Right.
Yeah.
Reliance on best research and involvement in continuing education is what they kind of said on
Obviously.
the site today. This is fun.
Yeah, I love this.
This is fun, I think, because we both really care.
Yeah.
And you know, let me take us out of here after your closing thoughts or whatnot.
Yeah. So I do have a closing thought, and it relates back to your initial question, which was, what makes therapy? Is that what you said? I can't remember. Like, what makes therapy
successful and productive?
Successful. And the truth is that all of you and our patients make therapy successful, because to me, that's a number one. You know, the authentic human experience makes therapy successful. And I just can't stress that enough, that if you have an issue, if you have a problem, if you have success and you don't know how to deal with it, if you have a hard time accepting compliments, therapy is for you.
Right.
This experience is the most authentic relationship that you can have in your life. And it's one that is guarded and protected, and it's for you and you alone. And I cannot express enough that what makes therapy successful is you.
That's cool. You know, I'm going to look at the camera and talk to you. Maybe we make this a little bit of a clip, because there are a lot of people that are struggling, you know, in the world today with COVID and the stress and the stuff that 2020 is just blowing up around the world. There really is a service, therapy, psychotherapy. We're passionate about it here at Metrolina Psychotherapy Associates, right? And in what we do. There is hope out there. There are a lot of people struggling, and you're not alone with what it is that you're experiencing. And I really want you to kind of understand that there is hope if you could find a psychotherapist that you can get a connection with. Don't struggle alone. Reach out. Like, get the assistance. You get a little bit from a show like this, and that's great. I love providing it. It's one of the reasons why we do it. But I want you to take that courage step, feed the courageous parts of yourself, and step into something that can absolutely change your life. Like, it can happen. Little by little, it can absolutely happen. And I've had the beautiful and wonderful honor of being with people that have done it before you many times over. So reach out and do that. I've got hope for you, just like people that I'm working with in a therapy relationship. If you're struggling out there, I will continue to contain that hope that you can get well and be more whole and full as a person, because I know that is possible. Whether that'll happen or not for you, I have no idea, but I know absolutely to my spirit that is absolutely possible for you. All right? Ma'am, let's get out of here tonight. I guess we'll see you next week, right?
Yeah, and I will see you in the morning at work.
That's true.
Yeah.
All right. See you then. Bye, guys. Have a great week.
Bye. Take it easy.